A sore throat, chronic cough, and bronchitis that just won't go away. Think you might have last winter's lingering cold? Maybe, but doctors at Mayo Clinic say for some people, those symptoms might actually be caused by acid reflux. They're in the midst of a study to find out if this is true and if heartburn medications can help.
Well, this is going to make a nice bouquet for Grandma.
Mary LaBrache thought maybe her symptoms were caused by an allergy to lilacs or some type of infection.
Bronchitis that wouldn't go away. A lot of times it was like I was had laryngitis, actually.
So Mary was surprised when doctors at Mayo Clinic said her throat problems were not likely caused by a respiratory infection, but by acid reflux.
I didn't really think I had acid reflux problems.
No heartburn, no sour stomach. You see, most people with heartburn feel it, that burning sensation caused by stomach acid sloshing into the bottom of your esophagus. But
in a small subset, it travels even farther up and causes throat symptoms.
Dr. Yvonne Romero calls it supraesophageal reflux. Symptoms: chronic cough, the feeling that something's stuck in your throat, hoarseness, sore throat, or constant throat clearing go away when you take a proton pump inhibitor. This medication is commonly used to treat heartburn. It works by turning off many of the pumps that produce acid in your stomach. Mary's symptoms decreased after she went on a proton pump inhibitor.
Can you help me put them in?
So now she can chit-chat with her granddaughter Madison as they craft bouquets. In addition to causing hoarseness, laryngitis, and recurrent bronchitis, reflux also eroded some of the enamel on Mary's teeth. Dr. Romero suspects that up to 10% of all visits to the ear, nose, and throat doctor are actually acid reflux cases. She hopes to have results of the study later this year. For Medical Edge, I'm Vivian Williams. Those who experience it say they will never forget the pain. Pain from a condition that strikes suddenly and, if left untreated, kills most of its victims. That's because many people who have an aortic dissection, a tearing of the lining of the artery carrying blood from your heart, think they're having heart attacks. And by the time they get the proper treatment, it's often too late. Surgery for this condition is nothing short of amazing.
I developed a terrible pain in my chest and my back.
In Chuck Bennett's case,
time is of the essence.
Dr. Patrick DeValeria knew he had to get Chuck to surgery fast.
The most common reason that people die of an aortic dissection is because it literally tears through and ruptures the aorta, and then they bleed to death into their chest.
Chuck's aortic dissection started at the aortic valve, the valve that controls blood flow from your heart. It happened because his vessel wall was weak. Blood pulsed through a layer of that wall, causing a tear that ran almost the entire length of his body. If it ruptured, Chuck could die.
All of this is blood where it doesn't belong.
To fix the tear, Dr. DeValeria had to use a surgical technique called circulatory arrest. First, he cooled Chuck's body from a normal 98 degrees to 60 degrees Fahrenheit, about the temperature of cool water.
And then literally drain all the blood out of the body so that the patient is, for lack of a better term, in a state of suspended animation. They have no blood.
After the tear is repaired, blood, life, goes back in.
It's a miracle that I'm here. And so, is it awesome? You bet. Jen.
Months after Chuck's incredible ordeal,
I won again.
He's back to enjoying the simple things like a game of gin with his wife Bea. Several thousand people in the U.S. die from aortic dissections each year. The key to survival is getting medical help fast. The three main risk factors for the condition are chronic high blood pressure, a connective tissue disorder that weakens vessel walls, and a family history of the disease. For Medical Edge, I'm Vivian Williams. Ask just about any of the 8 million people who are addicted to smokeless tobacco, and they'll likely tell you it's harder to quit chewing than it is to quit smoking. Why? One reason is that you can chew pretty much anywhere without anyone noticing. Another reason is that, unlike for smokers, no medications have shown to help chewers quit for good. Now, doctors at Mayo Clinic
It's something with fishing I like to chew more.
Chewing tobacco was a fishing trip tradition for Ryan Head. Even so, Ryan wanted to quit. He wanted to be a good role model.